Hello everyone. So welcome to our module Basic Infection Control 3. As promised, we'll still be having this on videos here in YouTube. And before I'm going to forget, please do like all the videos that you have seen. And of course, if as much as possible, you have to subscribe para nindot pudong taon uy mga addict. And then, just like all other modules, you will have a quiz here, just like we are having with your BIC2, and you have a final exam, and of course, you will have your return demonstration. A return demonstration here is more on the intradermal, intramuscular injection, intradermal injection. We also have your composite, and also we also have your MGT or nasogastric tubing nasogastric tube return demonstration. So just like all other modules, still you will receive a grade out of this. So make sure you do good. I don't like you to be trained as what we call hilaw. Gusto ko lutong-luto. So dapat kasama yung mga procedures na kailangan para ma-consider ka na you are that competent. Okay. So we have here next. So this basic infection control 3 deals with, as what I've said, special procedures. Why? Because you're not doing these procedures every day. Hindi po siya ginagawa every day. So these are not routinary procedures performed towards the client. What are those procedures not considered routinary? We have your bathing, you have your toothbrushing, you have also your feeding, and we have toileting. Those are routinary procedures. Nakakasawa po sila. Walang challenge kasi you have done those procedures, especially if you're dealing with clients every day, because that is the requirement, because that is also the reason why you are hired. But special procedures are procedures done by mostly nurses and those competent individuals or those who have license who have taken 4-year course. But since we were out of staff, what do you mean by out of staff? Kulang po yung mga nurses. And if the people, all elderlies, were going to hire nurses, of course, they were going to spend lots of money for it. Unlike with caregivers, medyo hindi ganong kalakihan din ang ibabayad nila compared to nurses. Plus, pag nurses naman ang hire nila, hindi naman nila ito mautusan na paliguan ng patient, pakainin, something like that. Kasi mostly yung mga nurses are more on procedures talaga na ginagawa. And then those routinary procedures are relied on the significant others. What do you mean by significant others? They are the watchers, the relatives, di ba? Significant others or the relatives of the patient, di ba? So that is why, para medyo, sabihin natin, what we call this one, initiative of the institution to make our graduates that competent. That is why we are also teaching, or we're going to teach you how to do special procedures. Just for example, your injection. Bakit kailangan? Kasi most of the clients all over the world are diabetic. Why is it that diabetic? Especially Asian, just like us, we are considered diabetic. Why? Because we eat rice. Another thing is female, especially female. Factor na po yung diabetes. Tapos yung height, o diba? Plus hereditary factors, hereditary lifestyle, and all those factors. Kaya dapat alam nyo kung paano mag-inject. Because plus point po yun para ma-hire ka po. Okay. And then for example, sa feeding din, sa patient, sa feeding sa tube. So dapat alam nyo kung paano mag-feed ng patient through tube. Kasi nga, nurses are that expensive for them to be hired. And mostly, your clients cannot afford. Hindi lang po kung they cannot afford to hire nurses every day. Mostly, they're going to have it once a week, visiting nurses, something like that, or contractual basis. But the one that are going to take care to the client 24 hours are all caregivers. Ha. So all caregivers ang mag-take care sa client 24 hours. Especially if wala siya watchers. Okay, especially pag wala siyang watchers. So perform towards the client. They are special because they are important in the treatment of the client's condition. As a caregiver, one should perform this procedure according to the agency's policy and if possible, under the supervision of a healthcare professional. Usually, pag ginawa yung mga special procedure, one time, big time, isang beses ka lang turuan, dapat spontaneous mo nang magawa yun every now and then. Okay. Kasi isang beses lang mapunta yung nurse, tapos sabihin na ito, ganito yung gawin mo, ha, ganyan, ganyan. So, pagkatapos that, they will be expecting a lot from you then. So, ikaw na po yung gagawa. No, di ba? One thing you have to remember, you should develop that confidence within yourself to perform all those procedures. Hindi pwedeng sabihin mo, hindi ko kaya. No. You have to do it. And you have to face it, deal with it. Okay. The caregiver will assist the client to carry out these procedures according to the care plan. Anyways, they will also what we call as endorsement, diba? They were going to endorse endorse the procedure to you if ever you will be the next caregiver for the shift. Okay, so we have when you say guidelines. We have the guidelines when it comes to special procedures. You have to follow the care plan. So as what I've said, the care plan is somewhat like your endorsement. It will be endorsed to you by the previous caregiver on duty or the supervisor or the nurse herself. So example, this is your care plan or the endorsement. Plan, you have here for Phil Villanueva. So, February 24, 2020 ang date. 6:10 a.m. So, dapat for 6:10 a.m. na ha, so galing po siya sa night shift ha. Okay, so ginawa niya po ito para sa kinabukasan na caregiver. O, hindi ko na-edit yung iba. O, tingnan nyo. Okay, so with the goal, Mr. Japhet Labial will reduce felt discomfort. Oh my goodness, nagkagulo na. So, hindi po yan Japhet ha, that is Phil Villanueva still. Discomfort, pain in his swelling right leg at 10 p.m. Okay, 2/24/2020. So, dahil sa gagawin ng procedure, ma-reduce po yung sakit o discomfort na nafe-feel ng client at 10 p.m. So, ready na dahil siya to sleep, di ba? Kasi 10 p.m. na. So, activities, what will you do? From 6:10 a.m., you have to apply cold compress at the right leg, that is leg, for periods of 15 to 20 minutes several times a day, starting at 10 p.m. So, that is your 2/24/20. So that is not 10 p.m. That is starting at 6 or 7 a.m. Nakagulo naman to. Sorry, hindi ko na na-edit. Okay. So that is your 6 to 10 p.m. So from 7 a.m. cold compress ka po. So expected at 10 p.m. the discomfort felt by the patient will be reduced. The caregiver will assist Mr. Phil Villanueva in taking oral medication to reduce swelling every 6 hours, starting those given 6:30 a.m. to 24, that is 2020. Actually, this is an old, as you have known, we have, what we call this one, we have started way back 2002. So, these are made by me during those time, mga 2004, I think. And tapos, ang nangyari, hindi ko na siya na-edit. 2012. Okay. And then, reminder, this is the client should see Dr. Aileen tomorrow, February 25, 2020. Okay. At 9 a.m. So, you have to be in giving your care endorsement or care plan, you have to be specific. Ha? Specific dapat, ha? Hindi pwede na bagdoy-bagdoy lang. Although na yung mga typographical error, I'm going to repeat. So the goal, this plan of care is for Mr. Phil Villanueva. Last time ago, I wrote it Phil Villanueva, and yet I changed it to Mr. Japhet Labial. So this is you have to change Mr. Phil Villanueva to Mr. Japhet Labial. So you want it change Japhet Labial to Phil Villanueva. So the goal is to reduce felt discomfort in swelling right leg at 10 p.m. Okay, to 10 p.m. So naka-reduce na daw yung goal mo specific mo, may time ka na dapat 10 p.m. Reduce na po yung swelling niya sa right leg na discomfort. Swelling plus discomfort sa right leg. Ano activity na gagawin mo? First is you have to do cold compress application. Of course, you have to be specific right leg. Kasi yung left leg walang swelling, di ba? So right leg lang ang meron. So that is why you have to what we call this one be specific. So 15 to 20 minutes several times a day starting at 10 p.m. That is not 10 p.m. ha, na mali siya. That is 6:10 a.m. or 6:30 a.m. Okay. Then 2/24/2020. So that is we have time, we have date, and we have also your year. The caregiver will assist Mr. Phil Villanueva in taking also of his oral medications to reduce swelling every 6 hours. So when will be your starting dose this time? Every 6 hours. So the timing of this will 6:12, 6:12, 6 a.m., 12 noon, 6 p.m., 12 midnight. Then the starting dose given is 6:30 a.m. So pag 6:30 ka, 2/24/2020 yan, hindi 2012. So 6:30 ka, so automatic your second dose would be 12 noon. Okay, wag mo nang pansinin si 30 pag dosage. Oh, kasi pag mag-SD ka, what do you mean by SD? Starting dose. Reminder to see Dr. A. Lim tomorrow, February 25, 2020. So, siya, specific siya, that is your 9 a.m. Okay, again, you have to be specific. Another, you have to be you have to follow the care plan because it will serve as your basis on what to do. Because it is also one of the proof that you are really rendering quality care to a client. Okay. Next, you have know your limits. Okay, know your limits as a caregiver. So, for example, the patient is, let's say, if the patient's pain is not reduced, even you are giving him mefenamic acid 500 milligram every 6 hours. So every 6 hours or Q6 hours, Q is every 6 hours. So kahit inanom mo na siya ng gamot, wala po sa responsibility mo na for example, hindi niya he is still experiencing pain. Wala po sa responsibility mo na sabi mo, bigay mo rin itong gamot na to, di ba? So, pag every 6 hours lang talaga, pag ganito, every 6 hours lang talaga, yan, no? Every 6 hours. Pag every 6 hours lang talaga you have to stick with the rule. Okay. So, know your limits. Hindi ka doktor. Hindi mo pwedeng dagdagan ng gamot. Hindi ka rin nurse na pwedeng bigyan mo ng another dosage. I-text ko na lang na doctor. No. Dapat, you have to know your limits. Okay. Notify your supervisor if you are unsure of the procedure. So, dapat, you have anything that will going to make you doubtful, you have to notify your supervisor. Hindi ka pwedeng, yung iba kasi, super confident. Kasi nga, hindi niya alam yung gamot, and yet, pinafeel pa rin niya sa patient na he knows or she knows what she's doing. Diba? Just like for example, I'm going to give you an exact example. Example yung suppository. Before we have an experience before that the suppository, instead of giving the suppository rectally, dapat rectal siya. Ang nangyari, binigay po siya ng oral. Oh. So, oral. So, what will be the problem na? Okay na kasi, suppository lang siya. Pero how about those mga crucial medications, those antibiotics? So, hindi ka po pwedeng magkamali doon. So, for example, yung suppository that should be given your rectally, ang nangyari, pinainom ng caregiver yung gamot. Example lang ha. So, pinainom ng caregiver yung gamot. Siyempre, the effect of your suppository would last, for example, mga 30 minutes. You feel that you're going to defecate, diba, after 30 minutes. And then if you taken it orally, pwede naman the same brand name, the same action, example, Dulcolax, diba? Pwede may suppository, may oral. Pag yung oral ang binigay mo, action 7 hours pa after taking the medication. So, matagal, diba? Para pag rectal yung ginawa mo, ang ibinigay mo, ang action niya is pinakamabilis, pinakamatagal, 30 minutes na. Because your rectal area is highly vascularized. So, it will react to the action. Of course, they will going to react with the medication and pushing out the action or the expected action of the medication. That's it. So, dapat you have to notify your supervisor. Just wait for a while, ha? Hello? Adjut lang. Nasa Bernard Subdivision. Adjut lang, ha? Oh. Sa Yayangs itiri, naog sa Yayangs itirigi. Yayangs. O, diba sa Ikigay? O, paagaw so na ako si Daddy. Sorry. Sige. Okay, ha? Sige. Bring my phone to the back para siya mas yan na si Jinjin. Kahit kuan. Okay, sorry for the interruption kay I have a call. And then we have also observed the immediate effects of the procedure to the client. Okay, so dapat alam mo yung effect. Example, cold compress. So, the action of the cold applied to the skin, of course, it will make the skin numb. Bakit? So, yung cold kasi, kung yung hot, ipadilate niya po yung yung blood vessel. Si cold naman, ipapanarrow niya si blood vessel. Bakit ipapanarrow? So that yung pain sensation mo, less na lang po yung mafe-feel. So that's it. Less na yung pain sensation because the blood vessels has been narrowed down. So that is the action of the cold. So you should have known that. For example, you have already applied cold compress and then the patient was still crying out loud because of pain, and then you have asked the patient, do you feel any numbness? No, it's painful, something like that. So that is the what we call the indication that the cold compress doesn't give any better for the patient. So you have to make another procedure aside from that cold compress. So that is to observe the immediate effect of the procedure on the client. Just for example, you have assisting the patient to drink medication, and yet the action of the medication, the patient's headache would be reduced, diba? And yet the patient is still complaining of his headache. So what will happen? So you would suggest, or you would going to report to your supervisor that the medication do no good to the patient because the patient is still experiencing pain. So baka kulang, baka underdose, diba? Or baka yung medication niya is hindi po siya, kailangan niya mas potent, hindi niya kaya yung biogesic lang. Kailangan niya mas potent, or let's say naproxen sodium, or what we call this ibuprofen. So baka yun ang ang pwede. Kasi nga, hindi na po niya kaya ng Gesic. Sa ako, hindi na ako nagtatabla ng Biogesic. Okay, next is observe any changes in the client's condition as a result of the procedure. Okay, so as what I've said, pagkatapos mo mag-cold compress, hindi siya nag-complain ng pain. So that's the immediate effect of the procedure. Okay, that is the immediate effect of the procedure. Then we have also your record what you have done and observe. So dapat you have to jot down everything that you have done and observe. You have to document everything because that is what will serve as your basis in case of what will happen to the patient, di ba? For example, biglang nag-collapse si patient, tapos, bakit nag-collapse? Tapos katatapos nyo lang pong bigyan ng gamot, di ba? Or let's say, bigla siyang nag-hypotensive or nag-decrease blood pressure. And then, binigyan mo naman siya ng gamot na pang-maintenance sa blood pressure. Bakit nagka-hypo by blood pressure? Nagka-hypotension siya. So, because you have jot it down, everything that you have done to the patient, so there may be chances that you will be questioned up, and because of that, what you call this one, because of that endorsement or the care plan of yours, it will serve as your evidence that you have really done your work, and then, what you have given to the patient does not trigger his hypotension. Okay. Kasi, baka na-stress lang siya bigla after bigyan mo ng gamot, di ba? So, let's say, baka na may tumawag sa kanya, o nangutang ba kaya, o hindi nagbayad sa utang. So, di ba? Or let's say, nag-drop yung potassium niya, di ba? Instead of instead of ma-regulate yung blood pressure niya, bumaba po siya kasi may kinain po siya or something, 'di ba? So you have to jot everything down. Next is, saan ba 'yun? Report any unusual symptoms to your supervisor. Example, unusual symptoms. Expected outcome is dapat pain will be minimized, and then lalo siyang umiyak sa pain. So that is unusual because you would question if ever that the patient really took the medication, di ba? Kasi walang effect yung gamot, di ba? So dapat you have to make sure that everything has been taken properly. Okay. So next naman, we were going to discuss now. So remember our discussion. We have the know your limits, the prepare care plan, and all. Notify your supervisor and all. So remember the guidelines. Okay. So now we have the medications. Medications or the drugs. Okay. Substance used in the treatment of disease or illness are called drugs. We have kinds of medications. We have over-the-counter or the OTC. And then, it means it can be bought without a prescription. Diba? Have you noticed that you cannot buy anymore your antibiotics on over-the-counter or OTC? Meaning, you cannot purchase them in the pharmacy. Bakit? Kasi nga, they are already regulated, considered regulated drugs. What are the medications that could be purchased over the counter? Those medications who are considerably mild, just like your Biogesic, those Quenil S, what else? We have also your, ano pa ba? Mefenamic acid, those or generic mefenamic acid, what else? So those are considered mild, and it has ill effect, but what do you mean ill effect? It causes harm, and yet hindi masyado, just like compared to those others, or just like your antibiotics. So they are considered over the counter. What else? We have ointments. All topical medications are considered OTC or over the counter. Next is RX or your prescribed, which are available through a pharmacist according to the doctor's order. So, what are the prescribed meds? Those mga meds for hypertension, na mga potent ones, and malaki yung mga milligrams, yun po. But for example, your mga general, for general treatment, that is your calcium block, general taking, calcium block, or the example, losartan, those are mga mild. You could still purchase that over the counter. But your Aldomet and all other potent drugs for hypertension, you cannot. Why? Because you need a doctor's prescription. Okay. So, kaya yung mga senior citizen, dapat may sila, may mga notebook sila na dala-dala para mabilang-bilang yung nila, mabilang yung, for example, yung number of tablets o na kailangan dapat i-minus, may minus silang ginagawa doon. Tapos after that, sabihin na, ma'am, na-consume mo na yung prescribe, kailangan mo humingi ulit ng another prescription. So, ganun po ang mangyayari. So, dapat, it is also a better way of saying na, you have to do a re-check-up. Diba? Or you have to do another or re-consultation. What we will be re-consultation? You have to repeat consultation. Bakit para? Kasi from time to time, you have to do double checking. Aside from that, you have to make sure that yun pa rin talaga. Kaya as we age, lumalaki yung kailangan nating gamot. Kasi as we age also, especially hypertension, our blood vessels thicken. So, nagtitiken siya. So, pag nagtitiken po yung mga blood vessels natin, automatic kailangan ng additional milligram or much higher dosage para to maintain our parang cardiac activities, diba? To prevent hypertension. Okay, so dapat mo kaya may 150 lang po na tablet, tapos after 150, the pharmacist will going to tell you, ma'am, na-consume na po yung 150 na prescribed. So, you need another prescription. Okay, paper para ma-consult. Meaning, you need another, you have to reconsult your doctor. Okay. Next, types of medications. We have solids, and we have, under your solids, we have your capsules, lozenges, tablets, ointments, and suppositories. Transdermal patches also. Capsules, I have a picture here para di mo maglisod, just like in your handouts. So we have capsules, small gelatin container that holds the medication. So this one, I'm pointing the cursor here, so you have the copy. It has a powder inside, ha. May laman po siyang powder. And yung capsules, some capsules are synthetic or plastic. And not really plastic, pero parang plastic. Kaya nga hindi dapat tayo palagi uminom ng gamot kasi yung mga remnants nito, just like the capsule itself, it might block our kidneys, okay, and it causes your harm. Another some also we have vegetable form of capsule na matutunaw, and some are not, or maybe some hard to. Sample pork base, they are hard to tunaw. So manang kailangan you have to, what do you call this one, regulate your intake of this. And then we have also your capsules. Examples of capsules. All antibiotics, amoxicillin group are capsules. Not all amoxicillin lang. But some also, for example, cotrimoxazole, they are capsule. Pero parang ganyan talaga yung shape nila. Ito, Next is your lozenges. They are flat disc containing medication in flavored base. So, example of this, we have your Strep Seals. What is the purpose of your Strep Seals? It is used to relieve sore throat. From the word of strep, it is Sore throat, the cause of your sore throat is your streptococci microorganism, diba? In our previous discussion in our BIC1. So, streptococci microorganism. So, gamitan mo siya ng strep seals. From strep is streptococci. Tapos seals, this is somewhat yung sealing or sealed. Pero para maging candy siya, kailangan strep seals. So, attractive siya. Strep seals. What is the purpose? It will going to counter attack the effect of your streptococci who is trying to gain entrance into your throat or your respiratory system. So remember, they are a resident microorganism, and if they are resident microorganism, they cause harm once they invade another part. So normally your strep seals is found in your oral cavity, but if it invades in your throat, it will now become infectious because your what do you call this one? Your resident microbes are opportunistic microorganisms. Okay, next is your tablet. Tablet are dry powder drugs that has been formed into small discs. Example, we have your Gardan, your Biogesic, your, what do you call them, my favorite drug, I forgot. The one with coffee. Sige na ato ha, nakalimot ko. That is used to relieve migraine. That's it. Because it has caffeine and caffeine. So we have also your ointments. Ointments are semi-solid material containing medications and applied externally. Anyways, your ointment could be purchased without a doctor's order. Just like usually anti-itch, diba? Anti-allergy. So you may have this one, we have your Histacort, diphenhydramine. Those are basta mga min-min. Oh, it has also your ointment. Then antifungal also, we have also ointments. So suppositories, so that is the picture. Suppositories are solid form of medication for insertion into body cavity. Saan po siya i-insert? Sa either genital area, they show flagyl or mebendazole. Flagyl or mebendazole, those women who suffers from itchiness in her genital area, possibly caused by fungi, so they were going to insert your mebendazole or your flagyl. Another, we have also your suppositories for, just like what I have mentioned a while ago, your dulcolac, diba? That is to fortification, diba? Especially if you're highly constipated. Or, for example, after surgery, and then you ask the doctor that you're going to go home, and then the doctor will tell you, have you pupo already? And then you say, no, wala, hindi pa po ako nakapupo. Then sabi, oh, you cannot go home unless you pupo. That is why to make you pupo, the doctor will going to prescribe 2 suppositories to be inserted into your rectal area so that you could defecate. Diba? Bakit mo hindi makapupo yung yung mga let's say na cesarean? Kasi po yung isang factor, yung anesthesia nyo, yung anesthesia na binibigay, it will going to temporarily stop the activity of your gastrointestinal tract. And of course, another thing, not another thing, and one of its action, it will going to withdraw all the fluids from your gastrointestinal tract. O, mo na, pag malibang ka, yung malibang, mura siya, bato. Mura siya bato. Mabukol ang labayan. Kaya walay tubig. And that is why when you're going to poo also, pag maglibang ka, magpupo ka, murag dako kayang magawas, and yet mura raog, julin kadako. No, it is very hardened. Okay. Next is transdermal patch or disc. Meds located on a small disc or strip that is applied to unbroken skin, absorbed through the skin over 24 hours. period. Example of this, we have your salon pass. So, di ba? And salon pass, what else? Yung mga gel na nilalagay sa skin. And then next is your liquids. Elixirs. Drugs is dissolved in liquid containing alcohol or water and with flavorings. Example of elixirs, we have your Gatorade. What else? Your extra juice, which is dapat hindi kayo uminom. And then another, what else? We have your elixirs. Gatorade. Ano pa? Ano pa bang Gatorade? Ano pa bang mga ano? Basta mga energy drink, those are elixirs. Okay. Then suspension, drugs is suspended in liquid and labeled as shake well before using. Oh, what are those? We have suspension example. We have your Calpol, di ba? And then we have also, ano ba yun? Ano pa ba? We have your suspension. We have your antibiotics na nilalagyan ng tubig, di ba? Tapos not Calpol because Calpol is syrup pala. So, we have yung mga antibiotics na nilalagyan ng tubig tapos distilled water tapos sabihin, shake well before using. And then another thing, put this inside the refrigerator. So, those are suspension. Okay. So, next is syrups. Medication is dissolved in concentrated sugar solution. So, we have there your Calpol, your Tempra, di ba? Those, aside from, we have Robitussin sa pabaylain and all others. Ambroxol, di ba? Asco, okay. And then we have drops, placed in a special container that allow one drop at a time to be administered. One is IMO. What else? Vicin. I think wala na po sila ngayon because they will not only destroy the microorganism in your eyes, specific for conjunctivitis, but they were going to destroy every microorganism, causing now your eyes to become favorable or target of the different microorganism. Kasi yung normal flora microorganism sa mata, tinatanggal na po ng vicin at your eye mo. Kaya nga, hindi ko siya pwedeng ibigay na ngayon kasi yung mga tala-tala na pag may ano lang, medyo hindi mo lang malinaw yung paningin, nag-a-eye mo at nagba-vicin na sila. So, tinanggal na po siya sa market. What else? We have your Maxi-Pro drops for sore eyes. Diba? And then we have your meter dose inhalers or your MDI. So small cylinders use a special delivery system containing a drug that is inhaled through the mouth in specifically measured dose. So those are for your asthma, ang your MDI. So you have had the solid, and then your liquid. And then we have also your MDI. So next, 4 kinds of drugs: the generic name, official name, chemical name, and then the brand name. When you say generic, given before the drug becomes official, so usually the generic name is the chemical name because the name of the drug, certain drug, is also the chemical present in the particular drug. Okay, example, ibuprofen. The generic is ibuprofen. The chemical there given is your ibuprofen. And the official name, it is also similar with your brand name. It is given by the drug manufacturer, and it is the name by which it is listed in one of the official publications. Brand name, example, Biogesic. What else? We have your Garden. We have your ano pa ba? Brand name. We have your Kreml S. We have your Losartan. Those are the brand names. Kapag sinabi mong amlodipine, those are the medication. The chemical, di ba? Example, Calciblock. That is your nifedipine. Calciblock is the brand name. Nifedipine ang chemical name. Okay. So, pharmacology is the study of the effect of drugs on the living organism. And then we have also the pharmacist. A person licensed to prepare or dispense the drug. And your pharmacy is the place where you could purchase the drug. Okay. Next, we have effects of drugs. Therapeutic effect. So this is the desired effect of the drug. While the side effects, this is the secondary effect of the drug. Example, there's an intended effect of the drug. Example, di ba pag sinabing pag uminom ka ng gamot, sabi ng doktor, take this drug with a full stomach. Meaning, busog ka po. Bakit? Ang side effect ng mga drugs or side effect ng mga gamot is gastrointestinal because they're gastric irritant. Mahapdos ang atong kuto-kuto. So, manang dapat, you have to follow the instruction. Okay. And then drug toxicity, deleterious effect of a drug to living organism. So we have the result from overdose, ingestion of drugs intended for external use. That is your drug toxicity. Okay, and then we have drug allergies, an immunologic reaction to the drug, which a person has already been sensitized, can either be mild, such as skin rashes, to diarrhea, nagkalibanga. This serves as an anaphylactic reaction to the drug. Or not anaphylactic, or just the chemical present in the drug reacts with your system and produces rashes and sometimes diarrhea. So anaphylactic reaction, if ever severe, we have here your SOB. What do you mean by SOB? SOB, shortness of breathing, o pag inom sa gamot, pag inom ng drug, hindi nahirapang huminga. There's your SOB. Shortness of breathing. Another, what else? We have your decreased blood pressure. Ito po yung sinabi ko kanina na ibinigay mo ng antihypertensive, pero masyadong bumaba yung pressure niya, possibly because he have taken drug for her allergies. Plus increased pulse rate. So these are the anaphylactic reaction. Again, anaphylactic reaction, SOB, shortness of breathing, decreased BP or hypotension, plus your increased pulse rate or tachycardia. So your responsibility as the caregiver is to assist in medicine administration. So what do we do? Bring medicine container to the client, loosen and remove the container lid. So just read this one, Supervise the client as he pours the meds into his hand, spoon, or cup. Steady client's hand while pouring medications. Direct hands for eye drops, dose drops, pre-poured medications and pre-filled syringes. Record what medications client has taken and record what medication. And record also the action of the medication of the client has taken. Watch for the desired effect. For example, the pain. So, pag inom siya dahil sa pain, so the side effect is mawawala si pain. So, that would be, if ever, baliktad ang nangyari, so, that would be now your problem. You have to report that to your supervisor for better management. And you have to record what you have done inside the medication sheet. Okay, so 6 rights in assisting medications. We have here the right drug, the name of the medicine as specified in the container. The label of the medication container should bear the client's name on it, if that is your right client. And then the right dose, exact the dosage of medicine as prescribed by a physician to obtain the expected beneficial effect of a certain medicine. Example, 1 tab daily. That is your right dose. Apply ointment on left leg, 1 cup BID. What do you mean by BID? That 2 times a day. And 1 tablespoon TBSP is TID, meaning 3 times a day. So, I'm going to show you how the doctors might write it. We have the right drug here. Usually, your name, Irene Lim. Then you have the address at the bottom, Bernard Subdivision. If ever, kinahanglan na siya Ozami City. And then you have also here also the date. What is the date now? You have to 5/21. 1/2022. Okay, and then now your drug. So what is the drug? We have here your Biogesic 1 cup, 1 tab pala, 1 tab PRN for fever or temperature increase 37.7 degrees Celsius. Oh, tapos ito po yung PRN med siya. So ganyan lang yung kulay niya, ganyan. Anyways, we're going to have a class tomorrow so that I could discuss this one. And then we have here your sign here as a caregiver. Sige, sign mo na sa obos, then caregiver dira. So, PRN meds. So, this is now the picture of your ticket. Okay, what ba? Mabasa niyo mo siya. We have here the name, Irene Lim. At meron siyang address here. And then next here, we have the date. Tapos sa baba, lagyan niyo po ng age. Age po niya. And yung gamot na po niya sa Biogesic, ganyan pong pagsulat ka. Yan. Pag yan, 1 tab, PRN. What do you mean by PRN? If necessary for fever daw or temperature increase, 37.7. Okay. So, pag 37.6 lang, wag mo munang bigyan. Pag 37.7 na, bigyan na po. Okay. Pwede pa rin i-cold compress pag 6 lang, 37.6. Okay, do you have any question? So, we will proceed. So, this is a PRN and PRN medication. PRN medication nga. So, kung sa hospital, this is blue ang color niya. Blue ang color when it comes to the color. Okay, blue. Next is your right route. So we have methods in which medication is taken. Example, oral, solid or liquid taken by mouth. So we have oral. Pag sabing oral, so sa baba. And sublingual under the tongue. Medication is placed under the tongue where it dissolves. Then we have topical medication applied to skin and mucous membranes such as your ointments, eye drops, and all. And the transdermal patch such as your salon pass is also topical medications applied to the skin. And meter dose inhaler, medication sprayed into the throat and inhaled into the lungs, MDI. We have also the parental medication. So we have here your types. You have subcutaneous medication that is just below the skin wherein needle is out at 45 degrees angle. While your intramuscular medication into the muscle, while your intradermal, so pag intramuscular into the muscle. So we have here the diagram. Here kanang naka-point siya, they show into your muscle. Subcutaneous naka-incline and your intradermal almost 0 degree, so 1/8 of an inch. And intravenous, we have also into a vein. Di ba? So, yun na ang picture. And then parts of the syringe, we have needle heel, bottle, plunger. We have also parts of the needle, bevel, lumen, and shaft. We also have adapter, the adapter yung connection po ng needle tsaka yung plunger. Adapter ang tawag doon. And the black one is your plunger seal. Then we also have a barrel, then plunger top. And then yung reading, that is your scale. And then needle hilt also is your adapter. Remember that needle hilt is your adapter. The lumen is the bangag. The bevel is the hait, the pointed one. And the lumen is the bangag of the needle. Okay. And then we have the right time. Excuse. Medication must be taken at the correct time in order to work properly. Example, 3 times a day, 8 a.m., 1 p.m., 6 p.m. I'm going to give you that tomorrow. And then the right documentation. Ideally, the client will keep his own record of medication taken. However, some clients are unable to write on the medication sheet due to physical disability or visual problem. In this case, the caregiver will record the information for the client. So you have to document also. I have here common abbreviations for you to memorize. Okay. So we have here every is like that is Q, drops is GTTS, MGH means may go home, DAMA means discharge against medical advice, TID 3 times a day, BID 2 times a day, OD once daily, IM intramuscular, ID intradermal sub-Q subcutaneous fat, TWC, terminate when consumed, TAB is tablet, PRL if necessary, CO2 is carbon dioxide, that is X, o kanang S is X. HHS hours of sleep, ER emergency room, AC before meals, PO means by mouth, NPO means nothing by mouth or nothing per RM, BP means blood pressure, BM means bowel movement, BRP means bathroom privilege, DC discontinue, KVO keep vein open, KSS keep set sterile, FX fracture, capsule is cap, SOP is suppository, O2 is oxygen, PC after meals, VS vital signs, TPI temperature, pulse, respiration. And we have other, and we have more pa. Daghan pa kay tanan. So kada lang ang akong gihatag sa inyo. So that you would know once you have given a chance to read the chart of the client. Okay. So before we're going to proceed with the HIT application, I'm going to label this as BIC 3.1. 3.1. Don't forget, so we're going to have a quiz tomorrow for this para dire-diretso na. After, we're going to have a quiz before we're going to start the class sa'yo sa preliminary. And then we're going to divide it into two. So, dayon seat application at after. Quiz na tomorrow, and then bring your syringes. Anyways, we have syringe in the school for sale. You could have that one. Okay, so okay. Now, don't forget to like, push the button below, and then like, and then you have to subscribe. And of course, share para daghan ang views. Okay, bye-bye. Bye mga impact.